When a nerve in your neck gets pinched, giving you pain in your shoulder, your upper back or down your arm, it's because this space where the nerve comes out of your spine gets closed down. Now 3 motions will increase that space again: retraction, traction and lateral flexion. So here's the best exercises with those motions to give you quick relief. For the first exercise, lie back with your hands fully supporting your head and your neck completely off the end of a bed or a bench. Then tuck your chin in, and keeping the chin tucked in, use your hands to lower your head as far as it will comfortably go. You'll feel a stretching and opening of the joints at the base of your neck or the upper back. If that feels comfortable, add the second component, which is traction. Keeping the chin tucked in and the head lowered down, traction the head away from the body with the hands. Hold this for a few seconds, then ease off the traction and lift your head back up using the hands to take the weight. Keep your chin in for the whole process and repeat 10 times slowly. If this motion hurts either in your spine or down your arm, then your neck is too inflamed for exercises, so you should ice it and go and see a professional. Next, we're going to increase the space for the nerve by tilting the neck to the side. Now, I prefer to do this with the painful arm behind the back, but if this hurts your shoulder or increases any symptoms, then instead you can hold underneath the chair to keep the shoulder down as you tilt to the side. Keeping the shoulder of the painful side gently down, tuck your chin in and back and slowly lean away from the painful side. Hold this for a moment, then look down at your hip and return back the other way. Do this 10 times slowly, but only in one direction, away from the side of pain. You should feel the muscles on the side of your neck stretch a bit as the joints on the side of your neck open up. If the mid-back is rounded, then the neck has to extend to compensate, and this closes down the space for the nerve between the vertebrae as well. So in exercise 3, we address the mid-back. This is best done on your knees, but if your knees hurt in that position, you can do a variation in a chair. Put your hands on or just in front of your knees, then start off by rounding out your mid-back and looking towards your stomach. Then move in the opposite direction, slowly pushing your chest out to arch the mid-back and bringing your head back. But keep your chin tucked down the whole time. Move until your neck is slightly extended, but don't lift your chin. Then return the other way and repeat 10 times slowly, keeping within a pain-free range of motion. In the last exercise, we activate the deep neck flexors of the neck to relax the tight neck muscles that often come with nerve irritation. And this has a nice tractioning effect on the back of the neck as well. With your neck in a neutral position and retracted a little bit, put both thumbs under your chin bone and then try to pull your chin down but resist with your thumbs. Think of lengthening the back of your neck as you press down against your thumbs. Resist for 5 seconds and do this 5 to 10 times as long as it feels comfortable to do. Sometimes these exercises will give you instant relief and sometimes it'll take a little while. If the pain's pretty intense, ice the angle of your neck just here 3 times a day for 10 minutes and do that a few days before starting to do the exercises. Now you'll know the exercises are working if the pain in your arm or in that upper back area, the rhomboid area, if those pains start to recede towards the base of your neck, you know you're improving. Looking at your phone in a flex position on the sofa or in bed is the most common cause of this problem. If you keep doing this, you'll never get better. Instead, lift your phone to a higher position with one hand supporting the other elbow when you sit, and lie on your side to look at devices in bed. Try to avoid looking up when you have a pinched nerve pain, as this will cause more compression and inflammation. And avoid leaning towards the painful side, as this puts more pressure on the nerves too. There's sometimes a bit of intermittent pins and needles or numbness into the fingers with the pinched nerve. And this is usually something that you get, say, in bed for a minute or two, but you can shake out. But if you get numbness that lasts for more than a few minutes at a time, or especially weakness in the hand or arm, then you need to go straight to your doctor and get an MRI to check out the discs and the structures in the spine. Good posture is the key to pinched nerves in the neck. So if you think your posture is a bit dodgy, check out my latest video on posture, and I'll put the link in the description box below. Anyway, that's it for today. Hope you liked the video. If you did, please consider liking and subscribing because it always helps, and let me know how you go in the comment section below. Okay, cheers.